the statistics that I've seen from the experts, there was an expert on Joe Rogan, I don't know whether you've seen it, and he gave some fantastic information out. It's 10 to 15 times worse than the flu. It acts like the flu, but it's not a flu strain. They're expecting around about 10 million hospitalizations over in America with 400,000 deaths. And Trump fired his entire pandemic team 2 years ago, didn't he? Tell me about that, Margaret. Tell me about what you think about the government's response to this epidemic.
Well, we are in a bad way. We have a president who's uniquely unqualified in general, but he's not very smart. He had no public policy experience, and he is also surrounded by people who are equally incompetent. So they don't think ahead about anything. This drive for austerity in the United States, which continues whether they're Republicans or Democrats in office, means that many things we need are being cut. And I'm sure that Trump, being who he is, or the people who advised him to do this, didn't think about it at all. And as he said at his news conference yesterday, he doesn't take responsibility for any. I mean, he actually said that in response to a question.
He blamed it on Obama, didn't he?
He blamed it on Obama, who has not been president for 3 years. I think you have like a 1-year grace period to blame things on a predecessor. I think 3 years out, you kind of gotta, whatever happens, you gotta own it. So we have this federal agency, the Centers for Disease Control, the CDC.
CDC, yeah.
Who decided not to use, I don't know why, not to use the diagnostic tests that the World Health Organization and the rest of the world use. So people have every symptom, have been to countries where the spread has been worse, have been in contact with infected people, and cannot get tested. So when you see that X number of people in the United States are infected, it's meaningless. We don't know.
Yeah, I heard a statistic saying there was somebody from, I think it was Idaho, an expert, it was some professional from Ohio, said that they think there's as many as 100,000 infected just in Ohio. I think it was Ohio. So we don't know how many people are going to have got this already, do we?
No, we have no idea. There are people who thankfully are exposed but do not become ill, depending on their health, depending on their age, all sorts of factors. But we have no idea how many people are infected. And, and Trump, even at his press conference yesterday, he's still shaking hands with people. Nobody's shaking hands. People aren't hugging, people aren't kissing, people are fist bumping, elbow bumping, just waving hello, everything except shaking hands. But he's shaking hands with people at this press conference where he should be demonstrating some kind of leadership, but he doesn't have it in him, so that's not going to happen.
I was in America. I've only been to America once. I spent about 3 months over there. In 2008 it was when Obama won the election in 2008. I was there and everybody was very hopeful and there was going to be change. It didn't quite work out that way. But I mean, the thing that really stood out to me 10 years ago, Margaret, was your healthcare system, or rather lack of it.
Yes.
We've got an NHS over here, as you no doubt know, and my mum was ill recently. She was taken care brilliantly. The NHS is wonderful. It's not like that in America. My friend had a serious illness, and he got cancer, and he had to basically go through, I think it was £100,000 or something like that. It was causing him. It was an underlying health problem, and then a few years ago he got cancer. And he was a person who was a great singer, Margaret. He's a fantastic singer. He sings at clubs and outdoor outings. Honestly, the guy is amazing. But it doesn't pay full time, and it doesn't pay enough to pay the bills. And he says it pays enough to pay the bills, but what it doesn't do is give me any healthcare coverage. I can't afford it. So he has to, this great singer has to take a job, and the job he took was in one of those, those car body sprayers things where they have to wear a mask, and this great singer in that environment. And the only reason he does that, a 40-hour a week job, It's just because it comes with health insurance, because you don't have a system over in America that cares for people. You have a system over in America that just makes money for certain people. How are you going to cope? How is America going to cope with this, with the healthcare system that you've got at the moment? I heard Nancy Pelosi the other day saying that the tests are going to be affordable. Can you shed any light on this? This is,
No,
this is...
Nobody knows. I mean, there are people who've already been tested and been charged a couple $1,000s. So first of all, the healthcare system depends on if you work full time, if you work someplace that gives you coverage. Of course, you're charged for it. It's not free. We do have the Medicare for people 65 and over, so seniors have coverage. The Medicaid system is for low-income people, but it's administered by the states. So here in New York, we get pretty good Medicaid coverage. In Texas, you would not get good. In fact, there are states where adults can't get Medicaid. I mean, in every state, kids can, but there are places where literally you cannot get it. So it's this, and even when you have insurance, people go broke when they get sick. I have a friend who had a cancer diagnosis a couple of years ago. He and his wife paid $1,500 a month for insurance. Then he gets cancer, and one test, a PET scan, they charged him $4,000. So, and he's broke. So now he's recovering from cancer by going on GoFundMe and getting people to help him out. So we don't have a healthcare. It's profit driven. Even Obamacare was really a bailout of big pharmaceutical companies and the big health insurance companies. They made a killing. So it's in the best of times, it doesn't work very well. Even with Obamacare, there are millions of people, they fall into this gray area. They're not poor enough for Medicaid, or they live in a state where it's not very accessible. And now we have this health crisis. I mean, there's always a health crisis. This has exposed things that always go on. People who can't get care or go into debt because they get sick. And now we have this communicable disease that is exposing what's already there. And these people are never discussed. They're never on the agenda. Our system exists by acting as though everything is fine and never talks about it. And now with this election, one of Bernie Sanders' signature proposals is Medicare for all, the system I just described that now covers all seniors. That everybody should have it, and the Democratic Party establishment does not want it. And Joe Biden, their favorite, said he would veto any bill that, if a Medicare for all bill passed in Congress.